and welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. Now, if you were with us, in a previous episode, we talked about, with Dr. Undie, who is the consultant urologist at Kelina Hospital, and we had a fascinating discussion on impotence and what to do about it. We're going to go a little bit into greater detail in this particular episode to really see from his perspective how he strategically and step by step approaches a man or a couple with the problem of sexual dysfunction and helps them achieve their goals of better, more satisfying sex, which, by the way, gosh, since we've started working on this, I've seen how remarkably important it is, and it's something that you shouldn't take for granted at all, especially, I mean, in our culture, if a man isn't able to perform, it's a pretty big problem. So it's very important that this needs to be taken care of, and we know that things like stress can reduce sexual function. We also know that sexual function inability can also decrease stress. So we're looking at an entire picture. And I don't want to spend too much time because I have him right here next to me and I want him to get right into it in helping Nigerians really to understand this concept more importantly and how they can deal with it in their own environs, whether it's Gombe or Katsina or Umuahia or wherever they are in the country. So we kind of looked at several different reasons why people have sexual dysfunction. And we want to now go into your approach to sexual dysfunction and some of the good results you've been getting.
You know, sexual dysfunction has to be differentiated from erectile dysfunction. Yeah, sexual dysfunction is a much wider topic. Erectile dysfunction basically is inability to initiate or sustain erection for sexual performance in an appropriate setting. If the setting is not appropriate, maybe an individual is with somebody he's not supposed to have sex with, probably will not have erection. So there must be appropriate setting. I prefer to assume that the majority of people do not actually have problem. When people are coming to hospital, they assume there's a problem. The doctor is going to do tests and he will find a problem. But most of the people actually have psychological issues. So I spend more time counseling. Sometimes it takes more than 1 hour with one patient. I spend a lot of time counseling people. I try to find out exactly what their problem is. You know, do they actually have erection or they don't? Do they have libido or they don't? Do they have erection with some other partner or is global? And then it becomes necessary to have their partner with them. I don't like talking to people who are not married because the things you want to talk about, you're going to go into a lot of detail that will involve actual sexual counseling. I've had a couple who never had sex after they were married because they were praying for God to help their family. And they came to the hospital because the woman was not getting pregnant. And they never had sex even once after they were married. So sometimes...
Were these...
in this country, Nigeria, yes. And both of them were virgins, you know. So sometimes you actually have to show people how it is to go about having sex. And then a month later, the woman missed her period. 2 months later, she was pregnant. So you need to spend a lot of time with a couple to find out whether they actually do have any discord. And you counsel both of them together. I don't want to do any laboratory tests at this stage. I prefer to examine the patient. If I don't find any physical problem, I spend a lot of time on psychotherapy, on counseling with the couple, both husband and wife. And then when they go home, I begin to practice their fantasies and things that they've been imagining. And everything according to what you agree with them, and the problem is not solved, then they can come back a week or two later. If the problem is solved, most of them come back to say the problem is solved. More than half of the patients come back to say...
More than half?
Yes, because we go into a lot of detail, and you try to find out how they go about sex, actually. Who initiates sex? Who is on top? Is it the man or the woman? Most of the time. And the effort the man makes, the effort the woman makes, the man, does he keep short nails or he keep long nails that wound the woman? All sorts of things you go into. How is their foreplay? How does the woman stimulate the man? How does the man stimulate the woman? Are they living with other people? Do they share accommodation with other people? How do they meet each other? Was the man introduced to the woman by a friend, or the family wanted him to marry, or they actually liked each other? Did they have sex before they were married, or they never had sex?
Why is that important?
It's important because most religious people who do not believe that it is proper to have sex before marriage, most of them actually don't even touch each other, they don't kiss each other. They don't know whether the man has erection or he doesn't. And they don't know the sexual behavior of the other person. And so when they get into marriage, it's a whole new ball game altogether. So you need a lot of counseling. They need a lot of counseling to understand that sex is no sin, that they are married, and that they could explore each other. They need to be alone. They need to be able to satisfy their fantasies, whether it's in the sitting room or bedroom or kitchen, everywhere they are. They need to be encouraged to be exploratory and not to follow one particular pattern they learned from somewhere. So psychotherapy, sexual counseling is very, very important. If that doesn't work, that is when I personally will move into doing laboratory tests, radiological tests, to find out if they have any organic problem.
Okay.
And sometimes they don't. And you discover it's medicines the man is taking that are causing problem. And sometimes medicine the woman is taking that are causing problem.
Really?
Because sex is directional. Yes. There are certain signals the woman will give the man that will make the man to be stimulated. And if the woman is not helping at all, you don't expect the man to just develop spontaneous erection citing the woman. It doesn't always work.
Look, I want us to get to talk about the laboratory tests when we come back from the show, from this short break. And I feel like I'm saying this. I think I remember saying this in a previous episode when we were talking about this lab test. So we're going to nail this one down. So we'll be right back. See you soon. Okay, welcome back. Okay, tests. I know we were during the break, we're talking about the hormonal levels and all that. So let's.
Yes, there's so many tests that we do. I spoke about psychological tests, and there are physical laboratory tests that we do for patients. If somebody has a problem with the liver, when you examine him, it's good to test. Is the liver function normal? Because that is the center of metabolism. Is the kidney function normal? People that have kidney failure actually have problem with erection. Is the testosterone, the hormones that control erection, are they normal? There are 4 basic hormones: testosterone, prolactin, follicle-stimulating hormone, luteinizing hormone. These hormones all interact one way or the other. Prolactin level is very high in the man. He will also have problem with libido, not only erection. Some of them have multi-level, multi-hormonal problems. If the testosterone level is low, it can be replaced. You know, we have synthetic testosterone available in most hospitals, most urological hospitals. Can be replaced. Then we look at the blood level. Somebody is anemic. It tends to have problems generally. It tends to be weak generally.
Sorry, Doc. Just go back a little bit.
Yes.
I noticed you mentioned estrogen or progesterone as one of the things you test for. Is there any reason why are they not important in this whole picture?
If testosterone level, if the patient has liver failure, you probably also want to measure estrogens because estrogens will be building up. If the patient doesn't have liver failure, liver function is normal. Estrogens are not important because most men do not produce estrogens that much unless you find tumors somewhere in the body. Of course, you do ultrasound scan of the scrotum or the genital area. Some people have varicocele, which can pick them on scan, and you discover that they have very low testicular volume, which will also reflect in the hormones. And then it could also reflect in the sperm count. If there's no problem with fertility, we don't need to do sperm count because sperm count and erector function, they are not actually related. They are not strictly related. However, if the person has testicular atrophy, testis is small, he may not be producing any sperm at all. The testosterone level will be low. In that case, they're related. Otherwise, somebody can have 0 sperm count and normal sexual function.
Interesting.
In fact, I've seen a man that had intersex. He never had any testes at all. He had ovotestis, and he had normal penis. He was having normal sexual activity. He was married, but he was azoospermic. He wasn't producing any sperm cell at all, and he cannot have children. So in a way, people can have erection without sperm production, and people can produce normal sperm count. They can have normal sperm count without any erection at all.
So those two are almost mutually exclusive.
So the test you do depends so much on what you find when you listen to the story, you examine the patient. Sometimes we even need to do MRI of the brain because certain pituitary tumors can also cause problem with erection. Sometimes you need to do tests on the spinal cord because spinal problems could also cause problems with erection. So there's no limited test that a doctor will ask for. The limit is based purely on what he finds when he listens to the story and he examines the patient.
All right, so we also want to talk about, you mentioned diabetes too in a previous episode about high blood sugar, triglycerides, Obviously, cardiovascular function as well. Those also play a role, don't they?
Definitely they do.
Okay.
Like I said, there's no limit to a number of tests. If a patient is having evidence of a vascular problem, you want to look at the lipid profile. Sometimes cholesterol level is high. But by the time cholesterol is as high as to cause obstruction to blood flow, even if you lower cholesterol, you may not reverse the picture. The person may actually require surgery. Like I said, treatment is in different grades. If psychotherapy doesn't work, sexual therapy doesn't work, sometimes the person may need hormone replacement. Sometimes he may need medicines that augment erection after he has been stimulated. Sometimes we need to withdraw medications that he's taking. And sometimes we move from that level to a level of injections. If tablets do not work, he may need injections, either hormonal injections or injections that are given directly on the penis that can sustain erection for a couple of hours, enough for sexual activity. Sometimes there are vacuum devices that can be applied on the penis to suck out the penis and then sustain an erection, and then a ring is applied for the erection to be maintained until the man is done with sexual activity. If that doesn't work, if everything fails, there are also surgeries that are done to augment the blood flow to the penis or to put an implant into the penis. The Nigerian Urological Association is organizing a workshop this year on penile implants. We want all urologists in the country to be trained on penile implants. Because the older people, if there's no blood flow, the nerves are not just there. Sometimes there are devices that we can put right on the penis. You can just touch a button and the erection is induced, enough for sexual performance. That is done when everything else fails. So there's so much to be done in that area. But the most important is resolving problems between husband and wife. That is the most important. People use excuse of medicines they're taking, excuse of so many things. But the real problem is that there is marital discord. That is the origin of all sins.
The origin of Some people may argue that it's because they don't have enough good sex. That's why they're having marital discord.
So it's a vicious cycle. You don't have good sex, so you have marital discord. And then you have marital discord, and you don't have good sex. And even though you don't have good sex, you have more marital discord.
It's a vicious, yes. It just keeps on getting worse and worse and worse and worse. Okay, so treatment, we talked about changing the medication just in case. So the doctor has to be there. I mean, somebody experienced has to be there to kind of like look at what the medications that the patient is taking, what they're used for, and if there's a suspicion that these medications can be part of the problem, then the doctor will need to change to medications that have a less impact on the sexual function. Wow, so that really calls for an experienced person. Well, okay, so in terms of, I think we'll have to come back for the next, next segment. But I'm also interested in seeing what are some of the things that they can take. I mean, I know that some kinds of nutrition can also help, and I know that some kind of medications, you mentioned the pills and the injections that can be done to do certain things. So I want us to talk about that when we come back.
Are you sure we can talk about that more than what we said already?
Well, we
don't want people to go injecting themselves.
We don't want them, yes, that's right. That's right. We'll be right back. All right, welcome back. All right, there's so much to talk about here and so little time to do it. But, Doc, we cannot let this go without talking about the importance of some general common sense principles. We've talked about good nutrition. I mean, if the person everybody should be taking fruits and vegetables. They should be sleeping well. They should be trying to avoid stress. They should be doing things that make them happy, right? Those are important things as well as everything that we've talked about. And I like the term you use, polyvitamin, because polyvitamin, polymineral is, as you mentioned, I mean, explain that some more, what the place of this polyvitamins and minerals are.
Yeah, I spoke about, polyvitamins. But, vitamins do not take the place of cordial relationship between husband and wife. That is the most important.
Yeah.
People should be friends. Vitamins do not take the place of sleeping well at night. As a matter of fact, sex itself induces sleep. So if the woman sleeps...
Especially in the man.
Yes, especially in the man.
Yes. If
a woman sleeps all through the night, the husband doesn't sleep. Why doesn't she get and give him good sex? Maybe he will sleep.
Yes.
It doesn't take the place of exercise, good health generally.
Yeah.
Exercise is very important for health generally. Exercise lowers cholesterol. Exercise lowers
cortisol.
Lowers the blood sugar level. Exercise makes somebody to be healthy generally. When you're healthy generally, you perform well at your job, perform well at everything. When it comes to sex, performance will also be different. And I'm talking about performance both on the part of the man, on the part of the woman. We are past the age where women will lie down flat and expect the man to do everything. Right now, it's supposed to be mutually activated. Both the man and the woman should help each other. And you know, adequate foreplay, if the woman's body is unresponsive, sex will be painful, sex will not be interesting to her. And then people should go into sex without any expectation. You don't go into sex because you must ejaculate. If the man doesn't have an orgasm, does the woman have an orgasm? If you cannot satisfy the woman naturally, but can you satisfy her by some other means? You make sure your nails are short, you make sure there's good lubrication, artificial creams are available. They don't cause any harm. Any cream you apply on your body doesn't cause any harm. If you apply it on the penis or on the vagina, it doesn't cause any harm at all. Yeah, a woman can have orgasm if a man stimulates her with his fingers. The woman should show the man what to do, and the man should show the woman what to do. People,
so communication is very important.
Yes, people use their lyrics, people use all sorts of things. They do that when they are not married. When they are married, they become very holy. That is absolute nonsense. And the people that are very holy also, when they meet another girl out there, they are no more holy. So when it comes to their wife, they are very holy. And when it comes to their husband, in fact, they are just returning from heaven. But there are things they are doing out there which the spouse doesn't know.
So we're talking about some hypocrisy here.
A lot of hypocrisy when it comes to sex. It's such a personal thing. People don't want to talk about it. And people don't want anybody to think that they ever do things like that. Until the stomach starts swelling, every woman wants you to believe that she never had sex since she was married. Oh, she never had sex before she was married, right?
Yeah. And she doesn't have sex with anybody. Oh, man. Serious. So folks, you really need to be open about certain things, especially with your spouse. Another thing I wanted to mention, since we're talking about this, is that the place of hygiene, good hygiene, because especially on the woman's side, women tend to be more sensitive to smells, and if there's body odor, the man doesn't brush his teeth like he should. His teeth he doesn't have good dental hygiene, or he's not trimming himself well. So same thing with the woman too. Yeah. That could be a deterrent, right, to enjoyment of sex.
I agree with you. Absolutely.
Yeah.
You know, men work late hours. They're the breadwinner most of the time, and they want to work hard. They come back home very exhausted, and they're sweating, and they don't want to take a shower, and they expect the woman to kiss their body, to lick their body. It doesn't work like that. You wake up first thing in the morning, you don't brush your teeth, you want to kiss your wife. It doesn't work like that. You know, we're supposed to be sensitive about our bodies. Right. And we're supposed to pay attention to what the man complains about or what the woman complains about. Because once the body is turned off, everything else turns off. By the way, we have agreed that sex is completely psychological. It's a lot of psychology involved in sex, right? So the moment you are turned off, either by the smell or by the sight or by something, everything goes. So hygiene is very important, especially when you are going to start using your body in contact with the other body. You are going to kiss somebody, every part of the body. Hygiene is very important. People should learn to shower before they want a lot of exploratory sex.
And I think people too need to take it as a study rather than just assuming that because I am a man and she's a woman, we know how sex is performed. The way we're doing it as a teenager may not be the right way. So I think people need to have some kind of sexual training in a safe environment. And I know there are materials out there now that show how to perform and how to stimulate, how to arouse, the foreplay and all that in a safe environment that people can learn from as a couple and in a non-threatening environment.
I agree with you. Yeah. Couples need to be very, very free with each other. They need to have the courage to talk about their sexual fantasies. Yeah. Sometimes something works very well with one couple. It doesn't work well with another couple. If people cannot communicate their desires, they cannot communicate their needs, they cannot communicate their fantasies, they will remain unsatisfied. You'll be surprised to find couples that have been married for more than 20 years who still have fantasies they've never had the courage to discuss with their spouse, to mention to their spouse.
That's a shame.
So they continue to suffer in silence, but they wish they could have it some other way. And then their mind goes back to some other person they had it some other way with. And that day infidelity sets in. So people should be free to communicate their sexual desires.
Very important.
The more communication people have, the better their relationship will be, and the better they can satisfy each other sexually. And people should go into a sexual activity without specific expectation. You don't go into sex thinking, I must have an orgasm. If I don't have an orgasm, then I will hiss. The woman will hiss and turn her back. That will kill the whole thing. You know, you go into sexual activity with expectation, without expectation. If I don't get satisfied, let it be that my spouse or my partner gets satisfied. If my spouse gets satisfied, maybe some other time. No. Some men ejaculate very fast when they have not had sex for a long time. You know, and then the second time they try to have sex, it will last longer. So if a man has not had sex for a long time and he comes and is excited, you don't expect too much from him. If he ejaculates early, it doesn't mean he has premature ejaculation. You know, give him some time. You know, after that, try it again, and you see that it may last longer. And then there are creams that people use that we prescribe sometimes that will numb the penis. Sometimes we even recommend a condom for a man that ejaculates too fast, because then it will reduce sensation. Maybe it's hypersensitive. The moment the penis touches the vagina, he ejaculates. You know, so let's pay attention to some of the things that our partners talk about. Let's pay attention to our hygiene, oral hygiene. Some men don't know they have mouth odor, and the woman is afraid to tell them. How often do you visit the dentist? How often do you have somebody assess your body? How often do you have the courage to ask people if they like the perfume you use?
Good points. Very good points. So, I mean, I love what you said about premature ejaculation, because that also is another problem that men face, and the women, of course, are unhappy with how the sexual function ends. So, gosh, they're screaming at us again. So,
you know, the men always get labeled, right? And that is bad. I don't support that. The man is the one who doesn't have erection. The woman doesn't have problem. The man is the one who has premature ejaculation. The woman doesn't have problem. That is bad psychology. I encourage my patients to know that some of these things are purely physiological. But I also encourage my patients to know that most of the time, the man comes before the woman. So the man should spend a long time on foreplay, to the point that the woman is almost having an orgasm before sex starts. If it's not done that way, the man will ejaculate long before the woman is even ready.
And then the vicious cycle continues. Guys, you can always check our website and the NTA YouTube channel for past videos of these. So if you have any questions, as always, you can check us up on our Facebook page, our Instagram page. So thank you again for joining us. God bless you. See you next week.